from today's topic, what are the few learning objectives at the end of this today's lecture? You all will be able to describe the mechanisms of autoimmunity, and you should be able to classify different autoimmune diseases, and you should be able to list what are the different autoimmune diseases. We know what is immunity. Immunity is the protective nature from the invading pathogens or any other allergens when entered into your body, which does not belong to your own body. What is happening when we born during our motherhood also, I mean during the pregnancy also, in the development stage in the wombs of mother, we try to learn to identify, our immune system try to learn identify which are the self antigens and which are the non-self antigen. This is very essential to distinguish between the self and non-self, because if your immune system does not recognize what is self from the non-self, then there will be a problem. The immunity which is actually a protective will leads to a harmful. So normally a person is tolerized to self antigens during the development of the immune system as a fetus, and later in the life by the other mechanisms, oral tolerization, such as Paul Ehrlich in the early last century has realized that the immune system could go away, and instead of reacting against foreign antigens, could focus its attack on self antigens. And that is why he has termed the term as a horror autotoxicus. And he is the first person who had narrated about the autoimmunity, which is having the deleterious effect on the body. So what is the main purpose of our immune response? It should differentiate between the self from the non-self antigens. There has to be clear-cut discrimination which belongs to us and which does not belong to us. If you look at this left slide, identifying self, if our cells are identifying our own cells, that means it is okay that you don't suffer from any autoimmune diseases. Even if it is a bacteria having an antigen on the surfaces, it should identify it as a non-self. It does not belong to the host cell, so it has to be eliminated. So autoimmunity is a problem of self non-self discrimination. Sometimes what happens during the adulthood or due to some other reasons, it is possible that your immune cells or antibodies does not recognize self from the non-self, and that is the main cause of the autoimmunity. So what is the definition of autoimmunity? Autoimmunity is a condition in which structural or functional damage is produced by the action of immunologically competent cells or antibodies against the normal components of the body. What does it mean? The antibodies which are produced by your immune response will not identify self from the non-self, or the cellular cells of the immune response does not recognize self from the non-self and starts killing our own cells. And that is responsible for turning that host into an autoimmune disease. It could be due to the copious production of autoantibodies. Large number of autoantibodies are produced, and autoreactive T cells. Even not only antibodies are produced, even the T cells are also produced, which are in the enormous number, which tries to kill our own cells. If you look at the population affected, 5 to 7% adults are affected, and it has been seen majority in the women. 2/3 of these cases are found in the women, and more than 40 human diseases have been so far characterized in the which has the autoimmune in the origin. Autoallergy is also referred as autoimmunity, but unanimously autoimmunity has been coined for the ease of the use. There are so what is autoimmunity? Is a condition in which as I told you, structural or functional damage. Either there is a damage in the structure of that cell or the whatever the organ is there, or there is it is non-functioning, is produced by the action of immunologically competent cells, and this is carried out by your own cells or your antibodies against the normal components of the body. Metalnikov has studied this experiment to find out what exactly autoimmunity mechanism is there. So he has inoculated guinea pig or injected with the spermatozoa, and which produces these sperms, and that is resulting into the immobilizing of the immobilizing antibodies, which means that spermatozoa has been blocked. They cannot move around, and this is proven by the Metalnikov in the guinea pig. Later, Donath and the Landsteiner, who have identified circulating antibodies, autoantibodies of course, in paroxysmal cold hemoglobinuria, which is a hemolysin which binds with the patient's erythrocyte. So this hemolysin, which is produced, is binding to your erythrocytes in the patients at the low temperature, and that results in the production of complement dependent hemolysis on warming. So this is again one of the autoimmunity mechanism. And then later Damashek and Schwartz has established the autoimmune basis of acute hemolytic anemia, in which your RBCs which are having the surface antigens are recognized as non-self, and your antibodies which are there supposed to be not to kill these RBCs or lyse these RBCs, starts lysing these RBCs, assuming that it does not belong to our body. Now coming to the features or characteristics of the disease of autoimmune origins. What is seen in the autoimmune diseases in the patient? There is an elevated levels of immunoglobulins, because of course autoimmunity is carried out by the mainly by the immunoglobulins and also by the cells, immune cells of course. So if you see a person suffering from autoimmunity or autoimmune diseases, there is always an elevated level of immunoglobulins irrespective of any disease, other diseases of course. And in this person, you can demonstrate autoantibodies. So this is second feature of the autoimmunity. Sometimes these immunoglobulins, they get deposited or their derivatives at the site of election, such as renal glomeruli. This is again one of the characteristics of the autoimmune diseases. Accumulation of lymphocytes and plasma cells at the sites of lesion. Plasma cells, of course, required for the production of antibodies, and lymphocytes are the primary precursor cells which takes part in the immune mechanism. They are accumulated at the site of lesions. It could be benefited from the corticosteroids or other immunosuppressive therapies. The occurrence of more than one type of autoimmune lesions in an individual. You can see more than one type of autoimmunity in a same person. A genetic predisposition towards the autoimmunity. This is again one of the feature of the autoimmune response or autoimmune disease. And if you look at the gender-wise incidence, it has been observed that it is very high in proportion in the females. And if you look at the chronicity, usually non-reversible. Once the person is detected as autoimmune or autoimmunity or autoimmune disease, it cannot be reversible. Very rarely it could be possible to reverse the disease, because it is a defect in the immune mechanism. So once there is a defect in the immune mechanism, it is not possible to reverse the condition. Now coming to the mechanisms of autoimmunity, why this autoimmunity is occurring in the patient, in a particular patient only, or in a particular person also. A variety of mechanisms have been proposed for induction of autoimmunity. First is the forbidden clones. Cells or tissues undergo antigenic alteration as a result of physical, chemical, or biological influences. We all are exposed to some amount of these influences, physical, chemical, or biological. During this, it results into a cell injury or tissue injury, and it undergoes the antigenic alteration. Whatever the antigen which is present on these cells or tissue will change in their structure, into their shape, into their molecular, what you can say, structure. And when they change themselves, they are called as neoantigens. Now, why it is neoantigens? Because they are new antigens. The previous antigens has undergone the alteration, which results to a new antigen. That is why they are being called as new antigens. Why they are occurring as a new antigens or new antigens? Maybe physical agents such as radiation can also cause antigenic alterations. We all are using these mobiles, so you know that mobiles are functioning on the basis of radiation only. So we're exposing to these radiations so many times in the entire day, and that might lead to the alternation in the antigenic structure of your cells. And this is the example of physical agents. Sometimes photosensitivity and cold allergy also sensitizes self-antigens. There are several drugs can also alter antigens. I told you in one of the lecture I'm allergic to some penicillins. So that can also lead to change in the structure of the antigen. And that is recognized by your immune response that it is a non-self antigen because it was not shown to them before. Now they have changed. They have become new antigens, and that is why the possibility of autoimmunity takes place in that person. Contact dermatitis, we have seen this in the allergy also, so the type 4 and hypersensitivity also, which is one of the delayed type of hypersensitivity, can also considered as the autoimmunity. Now, there are certain drugs which also induce the anemia. Okay, and then leukopenia, thrombocytopenia, which are also having the autoimmune basis. These drugs, they alter the cell structure, cell antigens, and they are responsible for making the person autoimmune. Infectious microorganisms such as viruses may also induce the alteration in the antigens. Probably you might have remember from the first lecture of general properties when I was trying to tell you the multiplication of virus in the cells. During multiplication, the virus attaches to the host cell, and when it enters its DNA material or RNA material into the host DNA, that time the cell itself changes its antigens which are present on the surface, and that is also responsible for becoming the new antigens. So microorganisms are also one of the cause of the mechanism of autoimmunization or autoimmunity. There are certain bacteria produces the enzymes can also alter antigens on the cell surfaces. Mutation participate in the alteration too. Of course, mutation can also lead to change in the antigen structure, and that can lead to autoimmune diseases. Immunological damage may result from immune responses induced by cross-reacting foreign antigens. There are certain organs or certain tissues which has got the same antigenic structure of bacteria or viruses. And after repeated infection of these bacteria and viruses, our immune cells will recognize our own cells that they belong to that bacteria or virus, and they start damaging the own tissue or the organ. This is because of the cross reaction in the antigens. It has been observed in the streptococcal infections. If a person is having repeated streptococcal infection, pharyngitis, this streptococci has the surface antigen which is called as M protein, and this has got exact structure of the heart muscle. Our heart muscle also resembles the M protein of streptococci. So they share the antigenic characteristics so much so that if you are repeatedly getting infections with the streptococci, then what happens? Your immune response, even if you're not suffering from the streptococcal infection, start recognizing your heart muscles as the streptococcal M protein, and they starts producing the autoantibodies, and there is a damage in the heart muscle. So this is one of the example of the bacterial infection which leads to damage to your own muscles, and that is again it is important organ of our body, that is heart. There is a spelling mistake in the heart. Similarly, nephrogenic strains of streptococci possesses antigens formed in the renal glomeruli. So the antigens which are present on the streptococcal surface cell surfaces are mimicking to the renal glomeruli. And what happens if the streptococcal infection is there again? It may also lead to glomerulonephritis due to the antigenic sharing. So these are the two autoimmune diseases which you should know. One is to the heart muscles and second one is the glomerulonephritis. There is also one of the hypotheses that there is a polyclonal B cell activation. What happens if a particular antigen is entered in your body? A particular antibody is produced, so that there is a specificity between that antigen and antibody, and there is a reaction and that antigen is neutralized. But what happens in the defective person, a defective immune response or autoimmune diseases, that same antigen which has been introduced is resulting into the polyclonal activation of B cells. What does it mean? It produces number of antibodies, different antibodies to that antigens. And what happens? This will result into a certain stimuli non-specifically turn on to the multiple B cell clones, and that will result into the autoimmune diseases. Continuation with the mechanism of autoimmunization, it can also be seen as enhanced helper T cell and decreased suppressor T cells in the form of their functioning. Usually, helper T cell and suppressor T cell work hand in hand. But if the helper cells activity increases and there is no activity at all of the suppressor cells, it means that CD4 cells are helping all the time and CD8 cells are not at all in the function. So that also lead to the autoimmunity or autoimmune diseases. It has also been observed there is a defects in the thymus in stem cell. You know the thymus is responsible for producing the stem cells, and these stem cells development, and they lead to production of the different T cells, educating and then proliferating of these T cells, and they go into the circulating system and they do their own function which is supposed to be self from non-self. But what happens? There is a defect in these cell stimulation or activation, and they start recognizing self as a non-self and are responsible for damaging own cells. Certain self antigens are present in a closed system and are all not accessible to the immune apparatus, are known as sequestered antigens. What does it mean? Our eyes have got lens antigen. Okay, these lens antigens are in the closed system. They are not there in the circulating system. That means they are not in the venous system or lymphatic system. So they are not exposed to the human cells. And what happens when there is a damage to the eye, or if the person is going for some operation in the ophthalmic, that results into the exposure of these lens antigens. If these lens antigens, they start going into the circulating system, and now though it is your antigen, the immune cells recognize it as a non-self because they have not been exposed. They have not been exposed throughout our life. But just because we have gone through some surgeries, ophthalmic surgeries, and now they are exposed to the circulating system, and your circulating system, which has the immune cells, they recognize as non-self and they start damaging the lens antigens. Okay, this is one of the example. Similarly, even the sperms. Sperms are there as a closed system. The sperms are not exposed to the circulating system. So what happens during we have learned in the mumps, there is orchitis. I have told you the complication of mumps infection in the orchitis. That is the infection of the testis. Okay, what happens? The sperms, they get they come out of this testis and they are entered into the circulatory system. and now they're not exposed at all, and our immune cells start recognizing it as a non-self, and that is why they start producing antibodies against that sperm, and the sperm will get damaged. Okay, this is also one of the example we have learned in the mumps in the last lecture. And finally, there are certain genetic factors such as defective in the IR or immunoglobulin gene that can also participate in the immunity. So there are different mechanisms of the autoimmunity. First is the forbidden clones, and forbidden clones means what? The antibody forming lymphocytes capable of reacting with the different antigens are formed according to clonal selection type. It means that there are always new antigens when there is a damage to the cell or tissue. Then second, new antigens or altered antigens. And third is the molecular mimicry. Molecular mimicry, it is called because the antigens of the bacteria or viruses are having the same configuration or determinants on our heart muscles or on our renal cells. That is why it is called as molecular mimicry. Then there is a polyclonal B cell activation. Then there is a difference in the function of the T4 cells and T8 cells. And there are closed system antigens such as lens antigen or sperm antigens, which are also responsible for the autoimmunity. And the next one is the genetic factors. This we cannot help. This is by but just because we have this defect, so we are succumb to the are prone to the autoimmune diseases. Now coming to the classification of the autoimmune diseases, based on the site of involvement and nature of lesions, autoimmune diseases may be classified as hemolytic, localized, systemic, or transitory diseases. But to the broad classification, it is divided into only two, that is localized, that is organ specific, and systemic, that is non-organ specific. Now we will learn one by one what are these localized and non-localized. Hemolytic and autoimmune diseases. Autoimmune hemolytic anemias. Probably I have told you this during our type 2 hypersensitivity reaction. What happens if I am A positive and I have been given B positive blood? What happens? I have the A antigen, donor has the B antigen, so they have the donor has the antibodies against the A, and I have antibodies against the B. So if I have been transfused the B blood, so what happens? Those antibodies which have been transfused from the donor will recognize my cells as a non-self antigens, and they start destroying the erythrocytes. So autoantibodies against erythrocytes are demonstrable in this condition because they don't know that these antigens belongs to self. So they recognize them as a non-self and they start producing against the antigens. And there are two types of antigens: cold antigens, antibodies, cold antibodies and warm antibodies. Now, what is the cold antibodies? Cold antibodies are complete agglutinating antibodies, and they generally belongs to the IgM. Remember this, this could be one of the MCQ also. So the cold antibodies are IgM antibodies detected by Donat and Landsteiner, frequently accompany with syphilitic infection. If a person is infected with the syphilis, then they produce these cold immunoglobulins, IgM, and they are reacting and they are causing the primary atypical pneumonia. So this is one of the example of autoimmune hemolytic anemias. And what are the warm antibodies? Warm antibodies are generally incomplete, non-agglutinating antibodies, belongs to the group of IgG, and that is responsible for the anemia. In this section again, autoimmune thrombocytopenia is also there. What does it mean? Thrombocytopenia, it means that there is a decrease in the platelet count. Autoantibodies are directed against these platelets, which occurs in the idiopathic thrombocytopenia purpura, traditionally considered as antibody mediated hypersensitivity. Again, it comes under the type 2. And third one under this condition is the autoimmune leukopenia. non-agglutinating anti-leukocyte antibodies can be demonstrated in the serum of the patients with systemic lupus erythematosus. This is the disease, autoimmune disease, which is again very common in the female. It rarely affects the males. So SLE, you might have heard about the abbreviation SLE. It is very commonly seen in the female patients and very rarely occurs in the male patient, and that can lead to fatality. So this is something serious. Now, in the localized autoimmune diseases, autoimmune disease of thyroid gland, Hashimoto's disease, you might have heard this word, Hashimoto's disease. It is nothing but lymphadenoid goiter. Anti-thyroglobulin antibodies in the serum of patients occurs more frequently in females again, and associated with the enlargement of thyroid glands and symptoms of hypothyroidism. So most of the time this test is done in the females because they suffer from this autoimmune disease, which is called as Hashimoto's disease or lymphadenoid goiter, or hypothyroidism also. Second one is the Graves' disease, thyrotoxicosis. Graves' disease, which is in which antibodies to the thyroglobulin lymphocytic infiltration is common. In this thyroglobulin, the lymphocytes are responsible for Graves' disease. Now coming to the next disease, Addison's disease. Lymphocytic infiltration of the adrenal glands and the presence of circulating antibodies directed against the cells of glomerulosa. So that is why patient is suffering from the Addison's disease, because their own cells, their own antibodies are produced against the glomerulosa. This one I have already referred to you, autoimmune orchitis. This we have also studied as a complication in the mumps. Lymphocytic infiltration and circulating antibodies are seen against the sperms and germinal cells. When the sperms, they get circulated into the blood system, those will be recognized as the non-self, and this is more, common in the male. This disease you might have heard because the one of the greatest actor of this century has been suffering from this disease, autoimmune disease, that is Amitabh Bachchan. Myasthenia gravis, you might have heard about him. He is suffering from myasthenia gravis. Abnormal fatigability of muscles due to malfunction of the myoneural junction. Why? Because antibodies are produced against the acetylcholine receptor on myoneural junction of striated muscles, and that is why patients suffer from the myasthenia gravis. So that the celebrity is the Amitabh Bachchan, who is suffering from myasthenia gravis. There are certain autoimmune diseases of the eye, which are those cataract surgery sometimes lead to intraocular inflammation, which is caused by the autoimmune response to the lens proteins. This is known as phacoanaphylaxis or phacoanaphylaxis. Why? Because the lens antigens are present in the closed system. They are never exposed to the systemic level, that is in the blood system, and that is why they have been taken it as a non-self, and that results into the phacoanaphylaxis reaction. Perforating injuries of the eye, particularly those involving the iris or ciliary bodies, are often followed by this sympathetic ophthalmia in the opposite eye. So that can also be that also leads into the second eye because of the autoimmune disease to the lens proteins. Pernicious anemia. Okay, there are two types of autoantibodies present. First, detected in the parietal cells of the gastric mucosa, which believed to cause achlorhydria and atrophic gastritis. Okay, and then the second type of antibodies are directed against the intrinsic factors or by binding to the B12 intrinsic factor complex. So that is why if a person is deficient in the B12, then that person might lead to pernicious anemia. Of course, nervous system also affected with the autoimmune diseases. And the example is the Guillain-Barré syndrome. This spelling चुकले परत. As बरेचसे spelling चुकले बरं, sorry for that. This is the idiopathic pyelonephritis, which is considered as an autoimmune disease or response against the peripheral nervous system. And the example is Guillain-Barré syndrome. It also been seen autoimmune diseases in the skin. Pemphigus vulgaris may be caused by an antibody to the intercellular cement substance, and the example is Pemphigus vulgaris. And then in bullous pemphigoid antibodies are directed against the dermal epithelial junction. So specific antibodies in determinants in dermatitis herpeticum have not been found. Now coming to the systemic autoimmune diseases, this consists of disease in which antibodies are directed against self-antigens and they damage several organs and tissue systems. Collagen disease, such as example, I have already told you, systemic lupus erythematosus, rheumatoid arthritis, polyarteritis nodosa, Sjogren syndrome, dermatomyositis, and scleroderma. These are the examples of the systemic. Now coming to the systemic lupus erythematosus, this is the chronic multisystem disease with remission and exacerbations, and later on it could become the fatal to that person. Patient may die, and it is, I have already told you, it is more commonly seen in the females than the males. Why? Patients have variety of antibodies directed against cell nuclei, intracytoplasmic cell constituents, immunoglobulins, thyroid, and other organs, antigens, specific antigens. So that is why it is a multi-system, a multi-organ system disease actually. So you find antibodies against various, against the cell nuclei, against the cytoplasmic cell constituents, or to the thyroid organ and other organs also. Biological false positive reactions are seen in syphilis. Probably if you remember anti-antibody reaction, which we are studying the syphilis, that time we have seen the biological false positive reactions. So anti-nuclear antibody tests are generally used to diagnose the systemic lupus erythematosus. Second one, which is again more commonly seen in the females, that is rheumatoid arthritis. And what happens in these patients? Patient's joints are always swollen. The next is pyelonephritis nodosa. This is a necrotizing ascites involving medium-sized arteries. So it affects the arteries. And the last one is the Sjogren syndrome. This is a triad of conjunctivitis sicca, dryness of mouth, with and without salivary gland enlargement, and rheumatoid arthritis. So this is how the autoimmune diseases occurs. What is the pathogenesis of the autoimmune diseases? It could be because of the genes, it could be because of the immune regulation, or it could be because of the environment. And what is the gist of this autoimmune diseases? It leads to the damage to your own organ or the tissues. And why? Because there is no proper training to recognize self-antigen from the non-self antigens, or sometimes your muscle antigenic determinants or your cell antigenic determinants mimics to the bacterial antigens, viral antigens, and your immune cells recognize them as non-self when it is actually self-antigens, and that leads to production of antibodies, and those antibodies are damaging our own heart cells. So what we should take the key notes from this: autoimmunity is a condition in which the structural or functional damage is produced by the action of immunologically competent cells or antibodies against the normal component of the body. So they do not able to recognize self from the non-self antigens. A variety of mechanisms have been proposed for the induction of autoimmunity, such as sequestered antigens, molecular mimicry, inappropriate class 2 MHC expressions on cells, and sometimes polyclonal B cell activation. Generally, autoimmune diseases is divided into organ specific or systemic. Autoimmune diseases are usually treated with drugs that suppress the immune or inflammatory responses. So what is the treatment? You have to stop this nonsense by the immune cells or antibodies not to recognize self from the non-self antigens. So this is all about the autoimmunity, or you can call it as the autoimmune diseases. I think I have done.
Yes, sir.
Yes.
I think I've done entire autoimmune chapter. This is one of the important chapter which you will be, may not be able to get any question on the theory paper, but definitely it is going to help you in your future life, because you might come across such autoimmune diseases, and at least you should able to know what are the different mechanisms of these autoimmune responses. तिथी आहेस का? तिथी दाखवे आहे का? आज नाही आहे. Soham?
Yes, sir.
Acha, I have done. If I have done now, your next whosoever are there for the practical 9 to 10:30 and 10:30 to 12. The live, I mean, again on team, Bhosle madam will be conducting your practical viva, which I have conducted for yesterday's batch C and D, I think, or whichever batch were there yesterday. So please send me the attendance of this
Yes,
lecture.
sir,
Lecture is
practical.
autoimmune diseases. Okay. Thank you.
Thank you, sir.